Okay, so this is the second chapter, right? So same thing in this one. Below, you guys should have the links. Okay, you should have the links for this chat. Okay. Let me put the link up for this. It's freezing outside. I know. All right, so we put that up because a couple of you guys were asking for this, so we actually put it in there. I'm trying to see why is it saying it's waiting, and we're already in here. I don't know why that looked like that. Cha-cha. All right, so, and again, you guys got any questions, just let me know. Let me see what's going on with this. I don't know why there's 3 here. This is your 8:30 chat. The chat should be listed. Okay, let me see what's going on with this one. Waiting for such. So let me go on there. Did I take the other one down? Okay, so we already took that down. I'm not sure why it's still waiting. You guys should not still be waiting for that chat. Okay. But at any rate, let me see. Do we got it on live or do we got it on record? Let me put this one on. Might be something. There might be something up with that one. So we are live. We're already recording. I'm not sure why it's saying that on the other side. And we're also on Twitch right now. So anybody on Twitch, you got any questions? Make sure you guys go ahead and ask me. We'll figure out what's wrong with that in a few minutes. It should be on. It should not be saying what it's saying right now. So if you guys are not... Oh, maybe that's the wrong one. So if you guys are not on, let me know. I look like I got 3 or 4 of them up there, but let me see if I can get rid of them real quick. Because it looked like I had 2 or 3 of them up there. I don't know what that is right there. That one with that beginning one, we got to get rid of that one. But again, you guys just make sure that you have those books. This is actually your second session. All right. Let me get in here and get rid of that one that's in there. I don't know where that one came from. It must have doubled when I actually put it on. So this one is saying upcoming. That must be one that I did in OBS or something. All right, so just make sure you guys are listening to that one. I don't want to take it off because if I take it off and I take off the wrong one, we're gonna be in big trouble. Okay, so I'm just gonna go ahead and remove this one, and I'm not sure where it is, so we can just take this one off because when it comes up, I don't want you guys to get confused with which class you're hitting. Okay, so I'm gonna take it off, and the other one we did it for 30 minutes. This one should not be on there. Okay, so you guys now should have the correct one on there. Because when I went in there, I'm looking for it. I'm like, but why is there 3 there? Okay, so we are now in the OBS. And in the OBS, I can literally put up a couple of screens for you. I can put up docs in the other one and PDFs and slides and everything, but I just kind of like to hang out with this one because I can do the Mac OS without that. Okay, so and this one again, let me fix this because I do this all the time. Your book is Elsevier, okay, and this is the one we are doing. I'm gonna open on this, and the reason I'm gonna open on this is because there are codes in here for you guys to do. Okay, this one actually has codes. Okay, so this again is your step-by-step book. So some of you who have not been in on this class before, this is your step-by-step book. If you are beginners to this class and you are only doing medical billing, okay, it's just as evasive as medical terminology and coding. You still have to make sure you get 80 on everything. Now, that's if you're in the Sapphire Academy. If you're just doing YouTube, no, you don't have that. The Sapphire Academy, there are tests in there, there are quiz in there, there are essays in there. You have an EHR practice management in there. You learn more in there from the YouTube. So that was a question too about the YouTube. Is it just a YouTube, or is it something else? Yeah, it's something else. My course is $1,349. But I have a grant for you guys, okay? So that grant is going to be still good for a couple of weeks. So I still got room for that grant. So you guys go on to Sapphire Academy and check it out. Okay, so that is your step-by-step book up there, okay? And this book, like I said, I want you to go to, what's that one we use, y'all? Thrift.com. Go to, if you want a new one, go ahead and go to Elsevier. Sometimes they have, y'all know, when they have a crash sale on Amazon, I'm the first one to let y'all know, okay? So just make sure that you get in on it, okay? Because the books are costly. I mean, that's going to be about the only thing with your program. Now, in the Sapphire Academy, there are free books there that you do not have to pay for. Your medical terminology, language and medicine book is also there. You can have the new one if you want to. But again, that's your Sapphire Academy. This one is a little bit different. You guys do have to get your books. Look at the links below. Same links are in Sapphire Academy. There are just a couple of other books in there that I put in there that's going to be free for Sapphire Academy to kind of help you guys out. Okay, when you go to my website, just click on the tab that says bookstore, and it's going to take you there. And just look for the $99 class. The grant is going to automatically come off. Okay, the grant is going to come off. Okay, so let's move on. So you guys see those codes up there, the CPT codes? And you remember I said if you can't find those codes, you see how it's listed, exactly how it's listed. If you can't find those codes in the index as such, you're going to flip those codes until you find them, okay? So I don't want you to get discouraged if you go back there and you look for a code and you can't find it. When you go to the index, okay, it's going to give you a code. Okay, you're literally reading your own notes. Right now, this is called open and closed questions. But if you had a provider's case, you could see what he has in the case. You could see what he has in the procedure. You could see what procedure that he did. So that identification is what you are looking for. If you, let's say you had a musculoskeletal case. Let's say some of these cases. Type it in on YouTube. You know, you sometimes in coding you have to almost feel like you're in there. You have to almost feel like you're in. You know, I was on Instagram. You know, I used to work in cardiology, and bless his soul, Dr. Graver was my doctor. He was a surgeon there. He died in a plane crash, but they redid the rooms. You know, of course they have a new surgeon and stuff in there, but LIJ just looks so nice. You know, and the first thing I thought about was cardiology. So yeah, now y'all know why cardiology is my favorite. Yes, I worked in the cardiology OR. Okay, no, I wasn't a surgeon or nothing like that. I just give them the instruments and get out. Okay, so you know, but again, you know, you have to visualize some of those procedures in order for you to do the coding on them. If you missed integumentary system, go back. Type in YouTube. Use YouTube as your guide. Anything that you want to code and you just can't visualize it, put it in on YouTube. Now you've got several different series. Okay, I would type in a surgical procedure on each series just to give me an idea. And the only reason why I can be more familiar and savvy with these series because I've been in OR rooms when the provider, the surgeon is doing these surgeries. So I can pretty much see what's going on. If I haven't seen one that's like it, I've seen one that's similar to it. I've seen craniotomies. I've seen open heart surgery. I've seen manipulations. I've seen all that stuff. I know I was a little girl back then. I was in, what was it, up in 1999 to 2003. I was in OR. So, you know, I mean, just don't forget those things, you know. But, you know, since you are beginners, right, and you are starting your journey, I want you to get used to the coding. Okay, musculoskeletal system is huge. In your CPT book, There are guides in your CPT book. Remember, this is a beginner class. I'm not going to point out codes and show you why this code is this and why this code is that. I'm going to show you your guidelines in your book. I'm going to decipher to you why you must understand what you're reading. So I'm not going to point out a code that you're going to use. You must understand why you're going to use that code. Reading your guidelines in your book. I'm touching my CPT book, okay? I know I have the ebook, but I want you guys to go ahead and open your book, okay? I'm on page 215. I have the 2026. Whatever book you have, just get your musculoskeletal system and turn to endoscopy, okay? Go to endoscopy. Mine is on page 215, okay? Yeah, I'm bumped to respiratory because I landed on this page. So it's okay. We're in the 30,000 series. What's respiratory, y'all? 30,000 series, okay? For endoscopy procedures, code appropriate endoscopy of each anatomic site, right? Because we code by anatomic site, right? From head to toe. In your CPT book, it's from head to toe, right? Surgical bronchoscopy. Break it up, okay? Always includes diagnostic bronchoscopy when performed by the same physician. I had to correct several charges because they did not add that. Okay, so you see the difference in me pointing to what you're going to code versus why. So your rationale must be explained. Okay, so when you are coding, you know why. The easy thing with the coding is, when you code and you understand what the question is going to be. I meant to send her an email. I know, I just thought about it. I know, I'm sorry, y'all. Yeah. Okay, she just reminded me. All right, so when you're coding, you need to understand the rationale of what you're doing. Okay, before or after. If you code and you get it wrong, when we do advanced coding and we do CPC guide, the rationale is in the back. You're using your CPT book and you're coding, your rationale is right in front of you. That this is your rationale. This is telling me that when I do that type of procedure, not me, the doctor, when the surgeon does this type of procedure, they ought to use endoscopy procedure codes. Okay? When he's doing the procedure himself. Okay? There's a lot of tricks in the CPT book that you must know. I'm turning back to musculoskeletal system. I just popped in there because the guidelines is in there. So in the step-by-step book, it tells you the same thing. You must read the guidelines. The guidelines is at the beginning of what you're getting ready to code. Okay, if you do not see any, it's going to guide you along the way. So remember, in musculoskeletal system, right? I'm in the CPT, right? Because we did step by step already. I'm pulling it up. We did step by step already. I just pulled this up for the sake of these codes. Okay, surgical arthroscopy ankle, you to do those. Diagnostic knee arthroscopy, you to do that. Shoulder arthroscopy, right? Arthroscopic repair of tuberosity, fracture of knee with manipulation. So remember, that's just telling you more deeper. You're going more deeper. Okay, I don't care if you spend 3 hours on it. Find it. Okay. Nobody needs to hold your hand and tell you where you're going to get this code at. You yourself can program your own mind to find that code. Look for the words. Let it put you back into the musculoskeletal system section and you will find it. Okay? So, because remember, this class is about passing your CPC. You must be able to navigate through this book. Okay? So, I'm on page 127. We're in the 20,000 series. Okay? Everything that you're going to talk about is already in this book. Okay, we've already started this. I'm just kind of backtracking a little bit, but this is where we still are in the CPT section of this book. I know it's supposed to be 30 minutes. Dang, that might not work. Okay, so fracture dislocation. When you get here, okay, it's merely guidelines. I'm in the front, but I want you to start from the beginning. When you see those illustrations, make sure you get the illustrations. You see a picture of the foot, phalanges, metatarsal bones. Make sure you get all of those, okay? But I'm right here where the guidelines are in the front of the book, okay? I'm going to take this down, okay? This is the book that you guys should have. This is for those of you who have just started with us, okay? This is the book that you're supposed to have. Your musculoskeletal system is going to talk about your format, okay? Fractures, dislocations, and general, okay? But I put this up here because that is your book, okay? Now, those of you who did not start this part with us, that's where we're at. Okay, musculoskeletal system, but that's the book that you need. We finished with that. So you're going to have to do the work in that, and you're going to have to do the workbook, and then we do this. Okay, so we do the step-by-step reading, theory, and then we do the practice. The practice you do at home. Y'all know what I mean. The practice is the workbook, okay? The answers is in the back of the book. Don't kill yourself, okay? So again, make sure you read those guidelines, okay? So, in musculoskeletal system, okay, which is the 20,000 series, when you get to codes that sound the same when you get to the end, I want you to highlight that, okay? So, y'all know what I always tell y'all, when y'all go through the CPT, you're going page by page. You're going page by page. Look at every single code, page by page. When you come up to codes that have that little plus in front of it, that's the add-on code. Okay? Those of you who do have your book, look at the bottom. You see all those, all these little thumbnails down here. They're going to tell you what they are for. Okay? They're going to tell you what they're for. So don't kill yourself with it. Go to, I know, I'm not saying that no more. That don't sound right. Okay, so your plus is that it is an add-on code. What does it mean when it is an add-on code? It is not your primary code. You are adding on a description. You are adding on something that the provider also did that cannot be primary. Okay, that is what the plus is for. Okay, here I'm on page 135. Replantation. Okay, you guys see this little section right here? And even if you don't have your book, y'all can archive. Even if you don't have your book, that's pretty much your guideline for what you're going to see right here. And it's actually telling you what you might need to use. It's telling you you might need a modifier 51 or 59, right? We did the modifiers. We did the modifiers in ICD-10 or the CPT class. Okay, your CPT class was the how-to. Okay, so go back to that class if you forgot. Okay, we can't go over that. So like I said, some of you who didn't start with us, just go ahead and archive from class 1. Okay, go ahead and archive from class 1. You'll just get up to us. Okay, so in replantation, it's literally telling you how you're going to code it. It's telling you what you're going to be looking for. So that's why I said, don't get scared of the coding. So those of you who do just want to do medical billing, that's fine. Go ahead and do the medical billing class. This is going to be repetitious. Once we actually finish with this course, I'm going to head right back to the same thing. Okay, and then I will be live on that. But even if you're in medical billing, don't hesitate to come in. Don't hesitate to ask me a question. Okay, so 20802, go ahead and look at that. Replantation arm includes surgical neck of humerus through elbow joint, complete amputation. Okay, so you guys see what's in those parentheses. I mean, I can see why they made the book so big now. It's a lot more description in the CPT than it was before. Same thing with the ICD-10. If you guys know that some of you are old as me, you'd know about the ICD-9. And the ICD-9 was not as detailed as the ICD-10. Once we all actually transferred over to the ICD-10, we were like, wow, I'm finding my code much faster. I mean, we complained about, moving over to ICD-10, but when we actually got there, they saw how easy it was, how much more, directive that was in there. I mean, the PCS came out, and I think the PCS was good because the PCS was strictly for hospital. And then, the girls in the hospital were easily directed with just the PCS. At Sapphire Academy, I'll give you guys a little taste of what the PCS book is. If you guys want to know that, let me know. Some of y'all are in the hospital already. Y'all know what the PCS book is. It's the PCS-10. It's like the procedure book, but it's a hospital. Okay. But the 20802, just take a look at that, because in the parentheses, I mean, it's literally describing what the procedure was, where he did it, how he did it, what he amputated. If you can't feel that, type it in on YouTube. Type it in on YouTube. The studying has to be retained. It has to be retained. If you are going to work in a specialty, just do the specialty. Okay? Just take cardiology. Okay? If you're going to do multi, you might work in cardiology for 2 years, and you might go to pediatrics for a year, do your CPC. I always say do the full CPC because it will help you better. Okay? It will help you better. I'm looking for the email. I know it will help you better. Okay? And I say that because, like I said, if you want to move around, what if you know a doctor? If one of my surgeons or my doctor friends call me from wherever, Lisa, I need you to so and so. Okay. I'm not bound to one specialty, but you have people who only want to do that one specialty. Like the OBGYN up there in Smoky Mountain, she only has one specialty, and she lost her girl. Her girl went to the hospital, and then I had to come in, but then I had to find somebody to take her place. She only did OBGYN, and she decided to leave. And I mean, this girl was her right hand for like 10 years. And I mean, can you imagine? I mean, it's somebody your right hand for 10 years and you lose them. Now they got to start all over. Did you guys know, God forbid, somebody passed away on a job, a company has insurance on you. A company can get insurance on an employee. It's called key employee insurance. Key employee insurance pays the employer the benefit, not the person who died, not the person's family. They get no benefits. The insurance will be paid to the provider because he's got a loss, right? When somebody quits, or I won't say DIES, and they got to hire somebody else, the hospital is going to lose a lot of money. When you quit, you know how much money they got to pay to train somebody? They're going to have to pay me double if I got to come back in there and train somebody from the scratch. But I'm just saying that as, Key employee insurance covers the job. I hate to use somebody I know. He was a correction officer. He died on the job. 25 years. Knew everything. He was a straight sergeant. Walked out the jail. Died right. Just dropped dead, a heart attack. Just right in front of the jail. And you know what? The facility has key employee insurance because it sounds harsh. I know it do. They have insurance that will give them a benefit because he died, because they have to spend money now to train and hire somebody else to make them an expert at what he did. You see, I'm telling you, it's unbelievable. Now, as far as the military, and they have their own. So, like military can't get like regular insurance because it is the military. They're gonna be in compact. They're gonna, something's gonna happen to them. When you lose one, you've got to hire. One has to come in. They have to build up that army. They have to rebuild that army. It's so sad when somebody does die, but the employer business will fall apart if he doesn't have the money to hire somebody else. So remember, when somebody quits or somebody resigns, the company always loses money. But when you're a business person, you don't care. You fire and hire them anyway. You let them go. You do whatever. We just build up from scratch because that money already, that business already has longevity money that they can lose. So they don't care if you go. You see what I'm saying? So when you have a backup, as such, you can almost have a sense of relief. Okay, so I can go work for 4 or 5 different hospitals if I want to. You see, or I could just work at home. So, remember, there's always a way. But to get you to that point, you've got to master this book. Okay? The ICD-10 book, go back to the ICD-10 class. Those of you who missed that ICD-10 class, you guys go ahead and go back to that book. Okay? And I'm going to take you through that step by step. I'm thinking that's the paper. I'm going to take you through that step by step. ICD-10 won't be so hard. Okay? I bet I threw that girl's thing away. It won't be so hard because finding a diagnosis is not going to make or break you. Okay? You will find it. The diagnosis is explicit. It's right there. A cough. Go look for cough. Okay? You'll find it. Okay? We're going to go over that more. But again, go back to your ICD-10 class. That class was about 15 sessions. Okay? It might have been 20. I'm not sure. You guys go back to that. But again, your studying is your brick. Okay? Your studying is your brick. What I'm doing right now, I want y'all to do the same thing. I'm looking through the musculoskeletal system for guidelines, for guidance as to how am I going to code this code. Grafts or implant. I'm on page 135. So here, codes for obtaining autogenous bone, cartilage, tendon, fascia. I'm not going to read the whole thing. They're telling you how you're going to code the implants. Okay? They're telling you how you're going to code the implants. Okay? In your CPT book, I'm on the 20,000 series. Okay? Now I'm about to head to the step-by-step. Okay? And the reason I'm going to the step-by-step is because of the codes that are in there. Okay? I'm heading for the step-by-step workbook. Okay? So this is where you guys, this is what you should have. Okay, that's the step-by-step work, but don't worry about it being 2026. Okay, it does not have to be 2026. Okay, most of them are the same. They have the same stuff in them. Okay, so musculoskeletal system, 15. Theory, practice, reports. Theory, practice, reports. That is what's in this book. Okay? The first one is musculoskeletal terminology. It sounds like I'm yelling. Okay? Without the use of reference material. Use reference material. Don't worry about without the use of. That's if I was in a classroom. But even if I was in a classroom, I still don't have my students. Use your book. Use your book. Okay, use your book. At the end of this course, as long as you pass that competency, you have passed this course. Okay, you have passed this course. Okay, this is not a test, so I'm not sure why they're saying don't use material, but we're using material. So, your CPT book, that you have right now, you're going to work with your workbook. Okay, so the musculoskeletal questions that are also in your theory and your reading book. You're also going to do the workbook, okay? So you have 11 right here that you're going to do, okay? And here, this is what's going to get you used to going through this section, okay? Application of force to a limb with the use of a pen, screw, wire, or clamp attached to the bone, okay? What they want you to do is find what is going to match to closed treatment, which we've already did, okay? Your answers to this is in the reading material, okay? I don't have two up, but this is the workbook. The other one is the reading. We did the reading. You remember we went over the bones, and I showed you guys those different bones and material. I know I did. Yeah, I'm not going back over that. Okay, so if you did not get a chance to get in on that class, just backtrack. Okay, go to video chat 39 or something like that. This one is actually, that one is 41. This one is actually 43 or 42 or something. I have to fix it. But anyway, you're just matching. Okay, and again, that's getting you used to the medical terminology. Okay, what else is in here? Okay, don't look at without the use of reference material. Look at whatever you need to. Okay. It's just asking you a question, okay? My phone is going dead. Okay, do you bill for the removal of a cast that your physician applied? Remember, we just did that about the cast, because you know the cast is included, right? And you're going to say why. Okay, and it depends on the first or the second visit. Maybe he went someplace else and got a cast, or maybe he went to another doctor and got a cast, or maybe he went to the urgent care and he put the cast on and now they're taking it off. It's included, okay? I know I said that fast, but I want y'all to look at your book, okay? Join the Sapphire Academy. We can definitely discuss it more, okay? So, practical, okay? Use the CPT book, your ICD-10 manual, okay? John is returning to the physician's office 2 weeks post-surgery for an application of a new long leg cast. The patient required surgery due to a traumatic fracture of the lower leg. Now, if you forgot what a traumatic fracture is, go back to class 39 or type it in so you can see it. Because remember when we were in the step-by-step, right? And I showed you all those different type of bones. Let me go back to the book. Different type of bone fractures. Okay. This is why you have to have all your books, all your books open in front of you. Okay. That's why I want you guys to make a table. Okay. Or use the kitchen table. Okay. So here. And like I said, those answers are in your book. Okay. That's the practice. Okay, that we did. That's the theory, reading, XYZ. That's why the first part of that in the workbook is theory, reading. Here, you remember what we did? Just go back to that chat and we went over this, okay? So, I know. That's why you all need to join the Sapphire Academy so you guys can all see this. I know. I'm going to put the link up there in case you guys don't have it. I'll put the link up there. But here's where we did those fractures at, okay? That's in your step-by-step book, okay? That's in the step-by-step book. So some of you who may not have that step-by-step book, hold on a minute, let me see. So y'all might have, I know the 2025 was there. I've already put it up there. But if you are new to this class, look below. You will also see the list of the books, and sometimes I do put them on the side. Okay, so here is, now if you're new and you just started this class, okay, here is the CPT book 2026. Okay, this book goes up to musculoskeletal system. Okay, but if you just started this class and you need to start from the beginning, I want you to read the book from the beginning, okay, until you get your book. So that's your general purpose of these books. Okay, I don't know who that is. Okay, so I know I supposed to have been finished. Um, some of you who just started my class, here is your ICD 10 2026. Okay, and again, this stuff is below. All right, I'm just giving you easy access. Okay, so the step-by-step book is crucial. The step-by-step book is how we teach you how to code. That didn't sound right. Y'all know what I mean. Okay, so okay, now these are 2026. Now, if you want to purchase these books from Kindle, just say purchase. Okay. Now, if like I said, if why is this still here? If you want to start from the beginning, then yeah, you're going to need the books. Okay, let me go into Teams real quick. Don't know why that's there. I don't know why that's there. Let's get rid of that. Okay. So let me put this up real quick. And this is because when I go through here, I can generally get it a little bit faster. What I'm doing right now is I'm going to Teams. I'm going to the Sapphire portal. The Sapphire Teams portal, I also have those books in there. And when I go through there, it just pulls up a little bit faster for me. It comes up on a different website. In the Sapphire portal, okay, in the Teams portal, this Teams portal is where the classes are. Okay, let me see. That's the Teams portal. Okay, that's where you guys will go. That's the Sapphire Academy portal. Okay, I think I have a chat that's coming up soon. And it shows you how and what the Sapphire Team portal is. This is how you navigate in the Sapphire Teams portal. As you guys can see, this is the Sapphire Teams portal, and that's the class that we were in. Okay, and this is all of what you need in the classroom, and all the same classes that we do here are already there. All you gonna do is click on it. Okay. But I'm not trying to go over, all the Teams portal. Okay, y'all need to go on my website and then y'all can do that. Okay. But here I'm looking for something. So hold on. Oh, wait a minute. I think I gotta get it from down here. Okay. So again, that's the Sapphire portal, and again we have EHR. We have so many different things in there, to train you on. Okay. There's PowerPoints in there. There's digital docs in there. When you go to the resources, you'll find all that stuff there as well. Okay. All I'm doing is just pulling up my. I'm just pulling up my ebook, my CPT ebook, and I'm pulling it up from the Sapphire portal. Okay. The Sapphire portal actually takes me straight to the web, so that's the reason why I like to go on the Sapphire portal and do it. But let me see if I can get this. Okay, so the CPT book that I just gave you. Okay, I'm looking at 2025, but I just gave you 2026. You're going to start from the beginning. Why, Ms. Lambert? Because I want you to. Because you have to know the start of the whole gumbo. I'm saying gumbo because of the Tina, whatever her name is thing. Okay, but same with your ICD-10. I'm going to pull that up in a few minutes. You have to know the rationale of coding. You have to know the rationale of your CPT book. Why do I need your CPT book? Why do I need to do coding? Why do I need to use 20,000, 21,000. Okay. In the beginning of the book, you must read the introduction. Your introduction is going to start off with so many things that you're going to do with this book. Especially is I'm just going to pip through, especially if you have not done the coding before. And again, if you have not coded before, don't rush yourself with it. Because remember, this is what you're in the class for, the coding. The coding. This is not for the people who just do medical billing, okay? This is for those who are, are doing the coding, okay? It's going to help you. When we get to the CPC guide, the first section of that is the business of medicine. I'll move that to medical billing so you don't get confused, okay? But the rest of it, I want you still to read all of the guidelines. I mean, even though we're already in musculoskeletal system in the advanced portion, you're still going to take your time with this, okay? You see how this book is telling you about dates, okay? It's telling you Category 1, Category 2, release time date, effective time date. That may be a question on your CPC. That may be a question. When does codes release in Category 3? And this is going to tell you, okay? As you go, I'm just kind of chipping through. As you go down and you start doing your reading, now you're getting familiar with the series and what you're doing, okay? There's 6 sections in the CPT. Okay? I know I can't go through all that. It's already I should be finished already. But when you join Sapphire Academy, you want to see all these things in there because I have several files and digital files in there to kind of give you notes before you even head for this class. Okay? So in the CPT book, you're going to read everything in the front of the book, the format of the terminology, CPT nomenclature. I want you to read just because there might be a question on there. What is nomenclature? Okay. Application submission, CPT code change. They're talking about when a hospital provider, a code, a APC, a HEMA, whoever wants to change a code, or we need to add a code. Like COVID, and we didn't have the COVID code in there. Okay, we still have to apply for that code. Okay, we used it, but it really wasn't in there legitly. We had to wait. We had to use it, but they eventually put it in there. So general criteria, category 1, 2, 3, it's telling you, it's giving you an idea of what this book is about, okay, and what you're going to be getting into, okay. When you get to A&M, you should stop. You get to anesthesia, stop. I forgot which one is first, resulting to, I think, anesthesia, no, special report. It's here. I want you to make sure you read this explicitly. We already did this in the CPT class, but I'm just cat-skacking because of, new people that might come in, okay? So, but, again, you can always get that from the prior class that we already did, okay? I just realized it was 9:23, but you're still going to remain in musculoskeletal system, okay? You're going to do your workbook. Okay, this is just an ebook. I just put that up there so you guys can go ahead and get that ebook. Okay, make sure you understand what an avulsion fracture is. Make sure you understand what simple closed fracture is. Oblique fracture, comminuted fracture, open fracture, break, right? Pathologic, old, right? I shouldn't say that. Fragile bones. Segmented type of fracture, spiral. I'll have to pull it up. You guys already seen this. Transverse fracture, a green stick fracture, impacted fracture, a Colles fracture, wrist distal radius, Potts fracture. Okay, I don't remember Potts. Okay, I don't remember that one. Okay, a compression fracture, crunch, right? In your book, it's giving you the descriptions of those fractures, okay? So some of you who may not have gotten in on that, it's already here, okay? Just because we've already did this book, you should be coding now. You should be coding, okay? You should be in your workbook coding, okay? Those codes that I already gave you, open and close, okay? Friday, we're probably going to be out of this, okay? But I want y'all to do the work, okay? We're not out of it. We're going to, by then, we might be into the CPC guide, okay? We're not out of it, all right? Read all the codes: repair, revision, reconstruction. 25260, 2563. Go to 25260 and go to 25263. So I want you guys to see how it indents. So see how the primary description is, and then when you get to 25263, it starts indenting. It's giving you more of a description. I'm looking for one that's, I don't know why I'm yawning. Okay. Oh, here. Go to fracture and or dislocation. 25500. So you see where it says closed treatment of radial shaft fracture without manipulation. That straight code is without manipulation. If you go to 25505, it says with manipulation. So you're not going to use 25500, right? If the doctor did not do manipulation. If he did, then you're going to use the 25505. Okay? So that's the kind of differences I want you to kind of look at. I don't know, my foot is itching. Okay? So, and don't forget, if you guys have any questions, you could always go to my website and ask a question. You can DM me here. I'm going to check my DM right now. Okay? Just make sure that you do the work in your book. Okay? I'm on page 169. That's where I got that manipulation code from. Okay, that's where I got the manipulation code from. Now, some codes, 25520, it will have a lot of what you need in it. So you might come across a code that has 4 or 5 different things in it. Okay, so then you don't need to go any further. You can just use that code right there. Okay, there won't be an indent. Everything is there. Like the 25500, closed treatment of radial shaft fracture without manipulation. Everything is in there that the doctor did. You just need that one. Right? 25560, closed treatment of radial and ulnar shaft fractures without manipulation. Okay? 25565 with manipulation. Okay? And it's giving you an idea of, number one, which code you're going to use. 2, what the provider is saying in his notes. What is the surgeon saying in his notes? What is the ER doctor saying in his notes? Is he saying it's a closed treatment with or without manipulation? If he says with manipulation, then you're using the 25565. If it is not with manipulation, then you're using 25560. So, and again, remember these differences in these codes, okay? Because some of them sound the same, but they are not. Okay, some of them sound the same, but they are not. Okay, so if I'm looking at the one that I just showed you, 25560, closed treatment of radial and ulnar shaft fractures without manipulation. 25500, closed treatment of radial shaft fractures. So as you can see, some of that code in the beginning sounds exactly alike. As soon as it gets to the end, it's different. That's what I want you to highlight. That end difference. So that you do not get these two codes mixed up. That little bit of a difference at the end, where it says ulnar shaft, highlight it. Because it's going to be different than the 25500 that you got up there. Okay, that they have up there. All right, so it's 9:30. I'm concluding this class. All right, you guys are in manipulation. Okay, you're in manipulation. You're in fractures. You're in dislocations. Okay, you're in reconstruction. You're in repair. Okay, that is what you're doing. Make sure that you read the guidelines with that. If you guys want to join the Sapphire Academy, please go to my website. Make sure you guys give me a thumbs up on this video. Okay, give me a thumbs up and make sure you subscribe to my channel. Um, if you have any issues trying to get the thrift.com, there are so many other ones that I just ordered a book from there. The CIMO, the Metasoft one I just ordered from there. I forgot how much it was, but I seen it for 115. I think I got it for like 20 something dollars. Okay, but again, check around for the books before you spend a lot of money on the books. Okay, so I appreciate y'all for coming to this classroom. Remember to use YouTube as your resource. Okay, go to sapphireacademy.com. You guys go ahead and join Sapphire Academy. You will get a download, an automatic download of orientation, which is 1 week. Your start date is when you start doing your work. You will get a schedule in the mail. You'll get a schedule in the email. In that schedule, you're going to put the date that you're going to start doing your classes. Your orientation is for 1 week. When you finish your orientation, administration will send you an email for Sapphire Academy. That's how you get into Sapphire Academy, okay? You need to have Microsoft to get into Sapphire Academy, because you will add your school email to your Microsoft, okay? And once you do that, then that gives you the authority to get into Teams, okay? I've already locked down what you need in there. You've got to get in there once I give you that email. Okay, so you can just go Microsoft, type in Microsoft, and then you can just kind of go in. If you don't have Microsoft, you can make up one and just put any kind of name in there. You can use your school name, or you can just add it to one you already have. Okay, so that's how you're going to do that. If you don't want to download the courses from the bookstore, just wait till you get your school email and you can look at them in the Sapphire Academy, or you can download from the Sapphire Academy, okay? Sapphire Academy is a huge resource for you. The classes that are done in there, you see more, you get more, okay? So that's why I always encourage you guys to join the Sapphire Academy. Okay, so that's your second portion of YouTube. Your classes will be done here. Okay, you get enough here to put you in the right place to do what you need to do. So $99 is not going to break you if you are going to learn something that's going to be for a lifetime. Okay, go ahead while I'm giving you that grant. Okay, go ahead while I'm giving you the grant. No, the grant is only for you. It's only for students. Schools do not get grants. They pay the full $13.49. Okay, and even if it goes back to $13.49, or when it does, I always take a payment plan, so you guys don't worry about that. Okay, so it's already 9:33. I am gone. Thank you for coming. You guys make sure you give me a shout out, send me a DM. See you guys in the next class.